We're also learning of some promising news tonight on the vaccine front as Pfizer went before some of our state lawmakers this afternoon.
News 8's Lindsay McCommel joins us from the newsroom now to share those. Lindsay?
Soon, Brian, we've learned that Pfizer is perfecting its own production efficiency to fulfill its contract with the U.S. sooner than expected.
The U.S. has purchased 200 million doses from Pfizer, enough to vaccinate 100 million people. During a state Senate committee today, Pfizer announced a positive development in that effort.
In the U.S., we're now planning to provide 120 million doses to the U.S. government by the end of March. That's a 20% improvement over our contract schedule. We also expect to deliver the next 80 million doses, so to reach that 200 million total by the end of May. That advances our timeline by 2 months.
Globally, Pfizer believes it can provide 2 billion doses by the end of 2021. In addition to cutting production time down, the company is now able to change its labels, fitting 6 doses in each vial rather than 5. One unknown is what our fight against COVID-19 will look like at the end of the year, and if vaccines against it will become a yearly shot like the flu vaccine, something Pfizer continues to study.
That next component to better understand the durability. How long will the protection last? Does this become more of an annual vaccine similar to the flu? And those are the questions that we're continuing to study.
Cohen also addressed concerns related to the waiting period between doses.
You could have up to 6 weeks, so instead of that 3-week or 4-week period, which was studied in our trial, you actually have a 6-week period.
Now, Cohen's last point is relevant to another development that we learned today on the state level. They're having to make some adjustments to next week's shipments because of a shortfall in second doses for patients. I'll be digging into that coming up at 6 o'clock. Sue.